Good morning, all of you. So, today's class we are going to study about the mechanical signals. So, in the mechanical signals, we have different types: pressure signal, apex cardiography, pneumotachography, dye and thermal dilution, fetal movements. So, the mechanical signals are the signals which are produced due to the mechanical movement. So, we call it as biomechanical signals. Now, let us see one by one. So, the first one is blood pressure signal. So, in the blood pressure signal, in the blood pressure measurements, we see we have in the last uh, topic bioacoustic signal also we have studied about the blood pressure measurement. So that is an indirect way of method of measuring the blood pressure measurement. So now this in case of a direct way of measuring the blood pressure measurement, particularly for the critically ill patients, we will be inserting a pressure transducer into the heart and then we'll measure the pressure signal. So that time we can able to monitor the movement of blood flow, those things. So here that is considered as a blood pressure signal. That is this pressure signal is considered as a mechanical one kind of a mechanical signal. So to analyze this pressure blood wave, so we have a pattern recognition methods. This is applied to analyze the pressure or blood wave, and the frequency bandwidth required is DC to 50 Hertz. Then we have apex cardiography. Apex cardiography is nothing but recording the movement of the precardiums. So we have different methods for recording the movement of precardiums. So those are vibrocardiography, kinetocardiography, ballistocardiography, and impulse cardiography. So vibrocardiography due to the vibrational movements, kinetocardiography due to the kinetic movements. So we can able to record the different way of recording the movement of this precardium using different methods. And the transducer used to record this motion, detect the motion is accelerometers, strain gauge, and displacement device like LVDT, linear variable differential transformer. And the bandwidth required for this particular apex cardiography signal is DC to 40 Hertz. The next signal we have pneumotachography. So what is meant by pneumotachography? Pneumotachograph, it is a device which is related to the airflow. Measure the airflow quantitatively to detect the flow of the respiratory gases and comparing it to the pressure drop against the small resistive field. So that is called as the pneumotachograph. This pneumotachograph, this is considered as a gold standard method for measuring the airflow because it is a large and uncomfortable one. So it's a qualitative measure of airflow. So qualitative measure of airflow includes monitoring the changes in airway using airway pressure and temperature at the nose and mouth of the patient. So usually nasal air pressure transducer which will be placed at the nose. It measures the pressure changes of the nasal airway between the inspiration and expiration process. And sometimes the oronasal thermal sensor, we call it as thermistor. It is used to detect the changes in the temperature of the inspired versus the expired breath, and also it gives the index of airflow. So to measure this airflow, not only pneumotachograph, we have that device transducer called nasal air pressure transducer, then thermistor to detect the changes in the temperature during the inspiration and expiration process. So this pneumotachometers, we call it, it is a flow resistive type device in which the gas is flowing through the tube containing a fixed laminar flow resistive element is there. This resistive element, it can be a fine mesh screen or we call it as a bundle of small capillaries, a flesh type. So which produce a pressure drop. It is linearly proportional to the flow so long as it is within a specified laminar flow range. So this UMO tachometer, so it can have a linear flow ranges appropriate to the maximum expected flow for a given subject should be selected. So here this pneumotachometer, it is considered as like a co-resistive type device. So which is used to record the movement of gases. The movement of gases is recorded using this pneumotachometer device. Then the next one is dye and thermal dilution. So why do we go for this dye and thermal dilution when we want to measure a cardiac output? What is cardiac output? The total amount of blood pumped out by the heart per minute. We call it as cardiac output. There are different methods to record the cardiac output, dye and thermal dilution method. So dye dilution method is also used to develop the cardiac output. In the dye dilution method, a dye known as the cardio dye, which is injected into that by means of a superior vena cava, will inject the dye, and this dye will act as a what is sort of transparent medium, so that we can able to estimate the cardiac output by means of integrating the dilution curve. So for cardiac output calculations, the first curve must be estimated. Then using the thermal dilution method, so we have a small device of Swan Ganz catheter. Using that, there are four lumens in that. In one lumen, the air will be spent, and another lumen, the water temperature will be maintained. In another lumen, the fluid will be injected to check the movement of the blood, that is to measure this cardiac output. So the injection of fluids having temperature different than that of the blood is determined by thermal dilution method. Then we have fetal movements. So fetal movements is when the fetus is present in the mother's womb, and it will move after the month of seventh month. So we can able to measure the fetal movements, whether we can able to identify whether the fetus is have in normal condition. So for that we can use the transducer called abdominal strain gauge and ultrasonic transducer to monitor the fetal movement. Then we have the next kind of signals. We call it as biochemical signals. Biochemical signals are usually performed in the clinical laboratory only. So some of the example for the biochemical signals are some of the blood gas analysis like PO2, partial pressure of oxygen, PCO2, partial pressure of carbon dioxide, and the partial pressure of hydrogen, so pH. So we go, and then some of the organic and non-organic chemical substances also, it is measured in the laboratory using certain devices and methods like chromatography, electrophoresis, flame photography, photometry, atomic emissions, absorption fluorometry, spectrophotometer. So like that, there are methods are available. Using that, we can able to identify any abnormalities which is present in the that is in the fluids in our body. So the next one is using specific ion micro electrodes are developed, so which allow the recording of ion concentration in variations of the neural cells. And some of the non-invasive blood oxygenation monitoring, we call it as by means of optical, we call it as oximetry.